Hi, my name is Kevin Wu. I'm an MPP graduate, class of 2019. Today is April 16th, 2020. I work at the Bipartisan Policy Center, a think tank located in Washington, D.C., and I've worked there for almost a year now. At BPC, I am on the Health Project, which is the team that works on healthcare access, coverage, and quality, and there's a separate team working on public health, but we often collaborate with them. Prior to COVID-19, I was working on projects dealing with low-income, disabled, and elderly patients on Medicaid and Medicare. And these same patients are the ones that have been disproportionately affected by the pandemic. So as a result, my colleagues and I are looking at more short-term recommendations in order to help them. Things like expanding telehealth so that they are easier able to access care. Speaking for myself, two challenges that are top of mind for me right now that I see are the loss of insurance by those who previously had insurance through their jobs, and those who are previously uninsured. They're unable to get coverage right now because they might not qualify for Medicaid or marketplace plans are too expensive. And then also the fact that safety net hospitals that are serving a lot of low-income individuals right now are not getting reimbursed enough by the federal government, even though they have very high COVID-19 expenses. Separately, I'm also looking at how COVID-19 is affecting both Democratic and Republican policies currently and for the next 4 years. And thinking about Sanford, what I'm drawing on is both the team-based client-facing projects that I worked on, learning about how to talk with different stakeholders and incorporate all their different opinions into working on a deliverable. And then also the memos I wrote for different policy classes and the master's project where I worked on a longer research report. So my name is Kevin Wu, and this is why policy matters.